usually how we do this is we have you introduce yourself and talk a little bit about who you are and what you do. And then me and John Allen prepared some questions. So we'll probably just go back and forth asking you some questions. Zoom only gives us 40 minutes, so we'll try to save a little bit of time at the end in case you have any questions for us. But yeah, you can take the floor whenever you're ready.
Awesome. Sounds great. Yeah, thanks for having me, guys. So to introduce myself, my name is Julie. I am a doctor of physical therapy, currently living just outside of Baltimore, Maryland, working in sports physical therapy for a company called True Sports PT. And I graduated physical therapy school back in the spring of 2022, went to the University of Scranton, which is where I actually did all of my school. So I did a 7-year track, studied exercise science in undergrad, played field hockey, and then continued on into their DPT program. And it was during that time in undergrad as an exercise science student that I really fell in love with strength and conditioning and just understanding like human physiology and the body and how it works. And I felt like the deeper I dove, the more I wanted to know. And same thing with, my psychology courses and understanding like the mental and physical connection of the body became so fascinating to me. And so during my time as a graduate student, I got my CSCS and got the opportunity to work as a strength and conditioning coach at my college, where I got to train, a handful of varsity athletes on campus. And in that time during PT school, was learning about PT, but it was really my time in the weight room that was my favorite part of the day. And I started to kind of draw the correlation between the clinical side of PT and the pathology and the diagnosing and the things that we learn in class, with the practical application of actually coaching athletes. And throughout my clinicals, really worked hard on, connecting those two things. And then ultimately found myself in sports PT because I get to be a blend of that strength and conditioning and, clinical physical therapist, which is awesome. And then also want to mention that on the side, I run a business called Goal Set Mindset, where I host a podcast that I also started in physical therapy school. So it's really cool to see you guys doing your thing. Been at it for over 2.5 years now, and I have a podcast centered around just all things fitness, wellness, performance, and also do some fitness coaching. I do a lot of online wellness consulting work, and Goal Set Mindset is just another place for me to kind of let my passion run wild and do a lot of public speaking and things. So yeah, that's kind of a little bit about me.
Very cool. What was it like starting your podcast in PT school?
Yeah, it was tough. I mean, just a lot of imposter syndrome. Like, of course, it was tough in the way of figuring out how to actually run a podcast and how to get guests and the nitty gritty stuff. But just having those thoughts of like, damn, well, who's going to listen to me? Like there's so many podcasts out there. What's going to make me different? But what helped me a lot was just asking myself the question each week of like, what is something that I want to learn more about, or what is something that is currently interesting to me in my life, whether that be in my personal fitness journey, whether that be something I was learning in PT, or whether that be somebody I connected with on Instagram that I was just interested in and had them on the show. And so it was really just the repetitions of not missing a week and doing it regularly. And eventually you'll get people who shoot you a message and say, hey, I really enjoyed that episode. And just builds over time. But definitely understanding that confidence is a skill and not something that you just inherently have was really important in starting the podcast. And I'm so glad I started it when I did, because now it's something that I absolutely love doing.
Very cool. Awesome. All right. So I was looking at your IG and I saw the morning gratitude, and I was going to ask you about that. If you could talk about the morning gratitude and what that has done for you over the past few years. Very important.
Yeah. Yeah, of course. It's funny because it's something I've been doing for so long now that I don't even really think a whole lot of it. But when I get to chat with people, especially those of who I connect with online, they're like, damn, Julie, you're the gratitude girl. Like, what is this thing that you do? So kind of the short answer to that question is in May of 2020, I found myself in a really tough spot. Of course, COVID had just hit and I was a PT student at the time. Clinicals got canceled. Everything was just kind of flipped on its head. And during that time, my dad was also pretty sick and he was living alone. And I went to be his caretaker and help him through. And the stuff that was going on, it was kind of just every day going to sleep, praying that he would be okay when I wake up, and struggling a lot with just living in the present moment and battling anxiety. And being the nerd that I am, I read all the self-help books and I was just like, of course, into the mental and physical performance that you guys and I just discussed. And I'd heard about gratitude from a book that I read, and I'm like, you know what would it look like for me to try it for 30 days and see how it goes? And so I went to Target, because what else do you do during a pandemic? You go to Target and walk around. And I found this little notebook in the dollar section. And I was like, you know what? Here it is. And so my first day of morning gratitude was May 25th, 2020. And I committed to writing down 5 things that I'm grateful for each morning. And the only rule was and is that those 5 things have to be from the previous 24 hours. So it kind of keeps you more grounded in the present rather than just writing like my family, the roof over my head. Like, of course, those are great things, but it makes you really look up and see what is going on in my current life. And yeah, wanted to try it for 30 days, started posting it on Instagram just to kind of hold myself accountable. At the time, I had like 102 followers. I had this tiny little fitness account that I was super embarrassed to even have because, again, like, oh, Julie, you're going to be that girl. My biggest advice on all of this is be that person. Like, when you find something you're excited about, don't worry about what everybody thinks. But anyway, committed to 30 days, got to 30 days, kept going, got to 100 days, kept going. I filled 3 journals and I'm on my 4th. And today was day 1297 of morning gratitude, unbroken. And in terms of what I've learned from it, I mean, the biggest thing is just that repetitively doing this practice and forcing yourself, even on the really hard days or hard weeks, to find 5 little moments of joy makes your brain just so much more able to find them. So that now when I'm out, going to the grocery store and somebody holds the door open for me, or I have a really good latte at a cafe, or I have a patient that I just really connect with on like a good level, like the things that typically bring joy bring so much more joy because my brain is just like hardwired to experience that now. And so, yeah, it's been really cool to see it grow from like a scientific standpoint, learning about what gratitude can actually do to change your brain. And then also the trickle effect of a lot of people messaging me that they decided to pick up a gratitude journal because they enjoyed seeing my list that, I kind of vulnerably share every day. So yeah, it's definitely a fun thing and would recommend anybody try it out.
Wow, that's awesome. Makes me want to start tomorrow. Hmm.
Yeah, no, it's cool. And even if you don't do it every day, like I think the most power comes from consistency, just like with anything else in life. But just get a notebook and put it somewhere where you're going to look at it every day and write down some happy stuff. And now I have a collection of like really cool, happy moments that are also cool to look back on because I get to see how far I came. Like when I read in 2020, all of this stuff that was going on when I was in PT school, it kind of takes you back and you're like, man, 2020 Julie would never imagine where 2023 Julie is right now. And this is a cool way of showing that.
Awesome.
Yeah, consistency is definitely contagious. We people in our class that definitely talked about like how consistent we've been on Instagram and kind of just pushing out as much content as we can. And they've always talked about that, but there's always those kids in our class that we kind of hear talking about us and stuff like that. So it's definitely great what you said about just be that person and be that person to step out of their comfort zone and post on social media and just better themselves individually as well as just building the reputation in the community. So that's something that Josh and I have talked about before and reflected on and just kind of be like, he has a great mindset on it and just brought to my attention like we can be that people. Like we want to be those guys. We want to have that edge to us and it'll help us in the long run. So I'm glad you brought that up. That's something that we've definitely had reflecting from starting this Instagram and podcast.
Yeah. Oh, I love that. That makes me so happy to hear. Now, remind me, where are you guys at right now in your program?
So
We're both second years in
Nice.
our program at UMES. Yeah, and
Nice.
we're actually in the middle of our second part-time clinical experience right now. So we had our first like they're each 1 week. Our first two are 1 week each, and when our second one, and then January we start our first like full-time clinical fill.
Nice. Well, best of luck. That's awesome. And yeah, if I could go back and just like shake myself, I would, because I cared so much about what other people will think. And something that you'll realize too, once you step out of that comfort zone and you see what comes from it, is that people aren't thinking about you as much as you think they're thinking about you. Like, we have these insecurities and we're all different on this, but you think like, oh man, this person's gonna see my Instagram post and send it to their friends and make fun of me. And first of all, who cares? But second of all, people are thinking about themselves. They're not thinking about us as much as we think. And I want to read you guys a quote that helped me a lot on this topic. I heard it from my good friend Joe Rinaldi, which if you guys don't follow him, you got to check him out. But it's a quote from Friedrich Nietzsche, and it says, "Those who were seen dancing were thought to be insane by those who couldn't hear the music."
Mm.
And it's that idea of, yeah, if you saw somebody with headphones on jamming out to their favorite song and you can't hear the music, you're like, man, is that person like having a seizure? Like, what's going on? So those people who are criticizing, listen, let them talk. They're not hearing what you're hearing. They don't have that spark that you have. They don't have that excitement that you have. And that doesn't make you any better, just makes you different. We all have something that fuels us. For some of us, it aligns with our profession and it aligns with our career goals and whatnot. For other people, it doesn't, and that's okay. But don't feel the need to explain yourself to people who just aren't hearing the same music, because that's just the reality of it, is you're not on the same page. And that being said, find people who are, find people on Instagram who you vibe with, and hit them up and have them on the podcast. You guys are doing all the right things, and I can't wait to see where it takes you.
Thank you. Yeah, I'm sure it's super nice having Josh, and I'm sure it's the same way for him. Like, I couldn't imagine doing it by myself. Like, I really, really don't know if I would have been able to keep this up. And it's just been a blessing to have someone else in the fire with me going through it. So props to you for going at it by yourself. That's super impressive.
Yeah, that speaks a lot about like who you are for you to be able to stay consistent with what you're doing solo dolo, sort of say, as compared to like us, we're holding each other accountable every day.
Yeah, no, I appreciate that. And it's awesome that you guys are doing this as a team.
Yeah, so diving in a little bit about what you do, you talked about how exercise has been a huge role. I know are you new into CrossFit? You're starting that CrossFit. Have you been doing that for a while?
Yeah, I guess I can't really call myself that new anymore. I keep using that as an excuse, but I officially started CrossFit style training in March of 2023. So we're in December, so like 9 months ago. Prior to that, had dabbled in it a bit, taken some classes, was intrigued by it, but I've been following programming since then.
Nice. How do you find yourself implementing anything that you've learned, maybe like bracing for CrossFit, into your PT plan of care for some of your patients?
Yeah, for sure. I'm a huge advocate, and a little bit intense with the notion that as PTs, we have to be about it and we have to practice what we preach. And I understand that every PT clinic is different and we're not all like fitness-based physical therapists, but if we are going to call ourselves the movement experts, the physical activity, physical exercise experts, we've got to be in the trenches doing it ourselves. And whether that's CrossFit, whether that's running, whether that's Orange Theory, like whatever makes you tick, we've got to get out there and move ourselves, because yes, that will teach you more about how to coach and program for and modify an exercise than anything that you're going to learn from a book or a PowerPoint presentation, or depending on how good your CI is, sometimes even on clinical, you don't get a lot of that. So yeah, I mean, specifically, I really enjoy CrossFit because I love working with CrossFitters as well. And it's it brings it to a whole nother level when I've tried things myself and I can understand kind of the common movement faults. With CrossFit specifically, there's a lot of gymnastics movements. So a lot of like kip swinging, pull-up bar type of work, handstand work, a ton of barbell movements, Olympic lifting. And when I'm working with a patient, and they're like, yeah, I'm getting this like pain right in the front of my shoulder when I'm hanging from the bar. If I've never hung from a bar or done exercises there myself, how am I going to know what that feels like? So I've been able, through my own trial, error, and honestly injuries that I've sustained from pushing it and overtraining a little bit, I've been able to take some of the things that I've tried with myself and do it with patients. But yeah, and then definitely from like the athletic performance standpoint, I don't believe that as PTs we have to be amazing athletes at everything. So I'm working with people who are way higher level than I am in some cases, but knowing the fundamentals, understanding how to have a barbell on your back and how to safely move it and how to breathe and brace. Yeah, it's been extremely, extremely helpful. And not just with my CrossFitters, but just with my humans in general that I'm incorporating fitness with, no matter where they are on that sliding scale. I'm able to take what I've done personally, what I've done as a coach, and then implement it into PT.
Awesome. Thank you.
Now, if somebody wants to get started into CrossFit, like where do you recommend they start? Like, do you think there's a sort of like baseline functional performance that they must have before like starting CrossFit? Or
Yeah, like in terms of starting CrossFit, like
like
if like a person who wants to join a CrossFit gym and start competing in it or something like that.
yeah, like or if somebody's just like listening to this right now and they're like, hey, like maybe I want to try out CrossFit. Like
Yeah, yeah, yeah.
where do they begin? How do they know they're ready for it? Because it seems
Yeah, definitely. That's a great question. And I think depending on who you ask, you'll get a lot of different answers. Me personally, there's a quote, I don't know who said it, but CrossFit is for anybody, but it's not for everybody. Meaning like, yes, anybody can do CrossFit, and the programming and the style of it itself is designed to be scalable, to be progressible, regressible. So anybody can do it. However, it's not for everybody because there is this level of intensity, there's this level of competitiveness. I have my personal critiques of some of the CrossFit style programming and the fact that it can be a little bit, taxing in some ways. But in terms of getting started, I believe that the best way to fall into CrossFit is to have some kind of training background. In my opinion, if you've never lifted a barbell in your life and you show up to a CrossFit gym, you're going to learn. The coach is going to teach you, but there's going to be 15 other people around, and a lot of them are going to be sweaty and have their shirts off, and it's going to be super loud and overwhelming, and it might be a little bit tough for you to get comfortable and confident in that environment if you've never been in a gym. However, it doesn't mean you can't do it, but for the person who has experience in the gym, who's been like going for a couple months or a year or what have you, and they do legs and then chest and then back and buys, and you've done some stuff, but you're looking for that next level. You're looking for intensity. You're looking for somebody to tell you what to do. You're looking to walk out of the room every time feeling like you got a good workout. That's the best time to go and try CrossFit. And then also having some degree of body awareness, because just like when you start any new thing, whether it's CrossFit, running, basketball, whatever, like you're going to run into aches and pains here and there. And having somewhat of an awareness of like, what are your strengths? What are your weaknesses? What's worked well for you in the past is going to help you kind of sift through just the things that come up when you're navigating a new activity.
Awesome. So sticking with that population, like they're very exercise driven. So overtraining is probably very common when you're trying to rehab one of these athletes. How do you go about having that conversation with kind of like toning it back, and do you modify their homework at all when you're prescribing their home exercise program?
Yeah, that's a great question. And honestly, as a sports physical therapist, like that's my everyday is for 80% of my people. It's telling them, it's helping them create buoys, but like figuring out like where's the level of intensity that we can maintain right now. I do have some patients that I've got to be the one to be like, hey, let's do this fitness thing. But most of my people are already doing it. And like you said, with CrossFitters, yeah, like there's this just intensity inside of you that the mindset in CrossFit for the most part is you walk into the gym and you kill yourself every day. Like there's no such thing as like moderate effort or like RPE 6. Like it's like balls to the wall, let's go. So I have a lot of conversations with people about the fact that you will make fitness gains. Arguably, you'll make better fitness gains if the majority of your training is done in that sub-maximal range. So teaching them a little bit about the physiology of actually building muscle strength and muscle hypertrophy is there is a place to go heavy. There is a place for 1 rep maxing. There is a place to completely empty the tank. But on a daily basis, the sweet spot for actually creating adaptations is usually in that like 65 to 85% range. And whether that means that's the load on the barbell, whether that means that's your effort, over the long span, that's where you're really going to build your engine and build your base. And so when I see athletes that are coming in with either multiple different things going on, or they're like, yeah, I've had this shoulder pain for months and it just won't get better. You're exactly right. There's typically a conversation of, okay, we're going to do sets of 5 pull-ups instead of 12 pull-ups, or giving them little changes. What I will say, and one thing that I feel very passionate about from a lot of my mentors that I've learned, is I will do everything I can to make sure I'm telling a person that they don't have to stop. Like, the last thing I want to do is say, stop doing CrossFit, stop playing soccer, take a rest for 2 weeks, take some ibuprofen, and then get back out there. That's what the doctors are telling them, and that's so unhelpful. So what I want to do is sit down and really strategize with the person. Where are you having your pain? When are you having your pain? Is it the beginning of the workout? Is it the end of the workout? How intense does it get? What makes it better? What makes it worse? And saying to them, okay, Lindsay, I know that pull-ups right now are really bugging your shoulder. So we're going to pull back on that a little bit. I want you to do sets of 5 or 6 to the point where you maybe have a couple more in the tank, but you don't actually go to muscle fatigue. But since squats and burpees are feeling phenomenal, like, let's go hard on those. Let's put our energy into improving your squat. Let's take this time of recovery as an opportunity to excel in other areas of your fitness while we pull back from the pull-ups a little bit. And changing that mindset of like, hey, let's find a way that this can serve you is so powerful for all of our athletes. I feel the same way with post-ops. We do a ton of ACL rehab at True Sports. I've got girls who are, 8 weeks out from ACL surgery. They're just getting back to normal gait mechanics. They're not doing heavy lifting, but I'll get them on the bike and I'll give them some cardio intervals, and they feel so good doing something. So finding a way to still give the person that stimulus that's going to make them feel good, that's going to give them confidence, that's going to improve their fitness, while also respecting the problem area, that's the sweet spot. And that is honestly what keeps me excited to go to work every day.
That's awesome. Thank you.
Now, switching gears a little bit, I know you said you work with a lot of athletes, but you also treat pelvic floor too, correct?
I do.
Awesome. So my question is, so pelvic floor issues can feel isolating. How can we normalize the conversation around pelvic health and encourage people to seek help?
Yeah, definitely. That's also a great question. And it's so funny because if I sat down with you guys as a fresh new grad, I sure as hell would bet money that I would not be doing pelvic floor physical therapy. Like, it was not on the radar. I was not interested at all. And when I started my career with True Sports and really just fell in love with treating the female athlete through the lifespan, I began to notice that this was a common thing that women were dealing with, and men also go through it, but women much more commonly. And the best way to normalize it is honestly just to not be afraid to have the conversation about it. As a provider, as a coach, as a trainer, asking your patients about this stuff. And most people feel awkward in the beginning about these kinds of topics. Like, I have women that I work with in the gym. In the CrossFit space, it's relatively common for women to leak with like double unders or like box jumps, especially if they've had children recently. And women kind of laugh it off, and it's kind of this joke. But one thing that I've done is host a bunch of workshops where I travel around to different gyms in the area and I present on what the heck is a pelvic floor? What does it do? You crack a couple jokes here and there, you pass around a pelvis, and you lighten the air. And once you start the conversation, people really want to talk about this. Like, people want to know, what is this group of muscles? How does it affect my performance in the gym? How does it affect my life? How does it affect my sexual health? And when you find out what an important group of muscles it is, it becomes less taboo and less awkward. So I guess not being afraid to start the conversation. And for PTs out there who aren't necessarily interested in pelvic health, educate yourself at least to know the basics. because I can't tell you the number of people I treat in the gym, a couple of guys, mostly women, but guys too, who have a nagging hip injury, groin injury, SI joint pain, back pain. We do all the lumbar stuff. We do all the, lateral hip loading. We do all this stuff and we can't figure it out. And it ends up being a pelvic floor issue because the pelvic floor muscles refer in so many different places. So as an orthopedic or sports PT, it's important to at least understand what the issues present like so that you can properly refer. But I've had some people that I've worked with for 6-8 weeks and we can't make progress. And then I screen pelvic floor and I'm like, oh, an obturator internus, man, it actually does something. So yeah, it's a crucial piece of the puzzle no matter where you are in that field.
So going off that, like kind of touched on it, like males might not even know they have a pelvic floor. Like, that's a
Yeah.
common myth to males, and they're also very stubborn, especially with that kind of area. So like kind of as a PT outside of the pelvic floor area, how do you go about like kind of recommending them that they probably should seek help?
Yeah, it's tough. And you're right. I mean, I have had a handful of guys be like, wait, do I have that too? Like, yeah, you do. Um, yeah, and it's one of those things, just like anything else with PT, but especially with pelvic floor, like not everybody is willing or ready to seek like true pelvic floor physical therapy, which oftentimes requires like internal assessment, internal work. But there's so many things that we can do outside of that. So like usually if this gets brought up with a patient, I'll give you an example. We have a 17-year-old soccer player in our clinic right now. He's a senior in high school. He plays soccer. He has had groin pain, but more like pubic bone pain that he started coming to PT for. Initially thought hip flexor strain, adductor strain, like hamstring, we were thinking at one point. He wasn't on my caseload for the first month or so. He had been seeing some of the guys in the clinic and we were doing stuff that was helping, but he was getting this really sharp, like bone pain almost. And one day he came in and he's talking to, my colleague, and I hear him talking about how his pain increases when he coughs. And so one thing that comes to mind as a PT differential diagnosis that we should think of is, okay, is there a potential hernia? But for him, it would be super weird for him to have a hernia just based on his body type and everything. He got an MRI that ruled it out. But I told him like, hey man, there's a chance that some of your pelvic muscles are actually related to this. Like, would you be comfortable with me just kind of feeling around your glute area, up around your pubic bone, and see if anything lights up? And he's like, yeah. So I was asking permission, kind of explaining like, hey, here's what this means. Not calling it the pelvic floor, just being like, hey, there's some muscles there. Gonna kind of come near your butt crack a little bit. You put the glove on, like, and you're just feeling over the clothes. And I was able to reproduce his pain with palpation of essentially the medial part of the ischial tube. So literally like butt crack pretty much, and sent him back to the doctor. That's when he ended up getting his MRI. And he's diagnosed with osteitis pubis, which essentially just inflammation of the pubic bone. But all that to say, one of those deep hip rotators, which is a pelvic floor muscle, is the main contributor of his pain. And if I just went in hard and was like, dude, you probably got a pelvic floor issue, like poor kid would have ran away. So just knowing, I guess, how to ease into the conversation, asking a person, do you want to know about this? Are you open to this? I think this could be important. And then kind of letting their comfort dictate where you go next.
Great, thank you.
Now, what excites you the most about the future of pelvic floor therapy?
It's a really fun time to be in pelvic floor PT because there are some badass women in the field leading the research front on really looking at what is the impact of exercise on pregnant and postpartum women. There's this, general recommendation in the pelvic floor space that after a woman has a baby, they are given a piece of paper with all these instructions, kind of like a protocol. And one of them says, don't lift more than 20 pounds. And then she goes home with her newborn and her 2-year-old who weighs 35 pounds and picks them up all the time. And she's like, well, that doesn't really make sense. And so what we're seeing in the literature now is that women can and should lift heavy throughout pregnancy, continue to get that aerobic stimulus, continue to do the things that they're doing while respecting symptoms, while respecting heart rate, being mindful of some things, but women are actually having better outcomes postpartum when they continue to exercise during pregnancy, when they continue to maintain strength and fitness compared to those who don't. So I'm really excited about this because this is all brand new stuff, but women in the pelvic health space, whether it's pregnant, postpartum, menopausal, women feel so fragile and are made to feel fragile because of these narratives. So the fact that there's women in the space like Christina Previtt, she's, my favorite that I follow, who are conducting studies on, okay, is there something to this, or is this just bullshit that we've been feeding these women? I'm really excited for the next decade or so to see more PTs, hopefully more OBGYNs become aware of the fact that there's nothing to be afraid of with a 6-month pregnant woman, as long as she's not experiencing any crazy symptoms, just like you would treat anybody else in the clinic. So it's really cool to see how empowering the space is becoming.
And we're
Yeah.
super fortunate to have a faculty member on our staff. She was newly hired last semester, and she's a specialist in pelvic floor, and she's delivered a lecture on pelvic floor, and it was just very eye opening for people that have not heard about it, and not especially like you said, all these myths that we were probably believing beforehand. We were just shocked and educated on the myths about the pelvic floor. So it's super cool to hear your opinion on it and kind of see the parallels between what she was teaching us.
Yeah, that's awesome that you guys are learning a bit about it in school.
Yeah, from what I've seen is every therapist that like specializes in it or at least just treats it in general, they're very passionate about it. It's never just like, yeah, I do pelvic floor too, but it's just like very passionate about it and very excited about where it's going in the future. So it's definitely a cool thing.
Yeah, for sure. I mean, that's the absolute best thing to do as an early career PT is to find what gets you fired up. Like for me, pelvic floor is part of it, but honestly, it's really just female athlete, like all things female athlete all through the lifespan. And for you, that might be a golfer. For you, that might be neurodiagnoses. Like find your thing and just run fast in that lane. And yeah, that passion's really contagious, and it's something that we need in our profession because being a PT is really freaking hard. You guys will see on clinical, it's hard work. So what keeps you coming back? It's not the money, it's the passion. So find that thing that makes you tick.
Awesome. So we got 5 minutes here. Do you have any questions for us? Any final words you want to say? Anything like that?
Yeah, no, I think what you guys are doing is awesome. I mean, if your kind of general listeners are typically student PTs, just to kind of echo, I guess, some of my previous points, like find what makes you excited and what makes you passionate. And if you're listening to this and you're like, I don't know, I don't really feel passionate about any of this, don't give up on it, but get on social media and make that Instagram that you devote to your fitness or to your, PT journey. And don't be afraid of that, and find people that you enjoy following, even if it's just like 3 people. And then over time, you'll find more people that you're intrigued by, that you enjoy learning from. And don't be afraid to reach out, because I was sitting in the same seats that you guys are sitting in right now a few years ago. And I never, ever would have imagined that I'd graduate school, move to an entirely new state, take a job at this awesome one-on-one athletic facility. So many people told me, you got to move back home, you got to pay off your loans, like, oh, just take the job down the street, go work in the mill and get all of that experience. Please don't believe any of those lies that working in a mill is going to serve you, but that's a topic for another time. um, all the people that are going to be like, what? Oh my God, but Julie, you're from New York, you're going to move to Maryland, it's expensive there. Like, oh my God, you're going to get your own apartment. Do it. Like take the leap. The best time to take risks is early in your career, before you're like settled down and have a family or whatever. Even if you do, I mean, like go and follow that thing, because I've met so many PTs who are further into their careers, who are burnt out. Some of my CIs that I had, who just aren't excited, who are honestly quite miserable. And you wonder if they just feel stuck because they never got out of their comfort zone and pursue that thing that they really love. So don't let anybody tell you you can't. Even if you're young, even if you're broke, figure it out. Follow your passion.
That's awesome. Yeah, burnout is definitely something I don't see that in your future. You're definitely passionate about what you do, so that's awesome to see.
Thank you. And it's a balance. I have to turn my brain off sometimes and force myself to sit and do my meditation, do my journaling, do my prayer. Like my nervous system is always on high. And so sometimes I have to intentionally bring it down. But yeah, I appreciate that, guys. And keep reaching out. Like, don't be a stranger. Keep being curious. It's so cool seeing you guys doing what you're doing and being able to kind of get back in this way and chat with you guys. So thanks for having me.
Thank you so much.
Well, thank you a lot. We appreciate it.
Yeah, of course. And wait, where are you guys? Where's your guys' school? Where do you go?
So we're at Maryland Eastern Shore, which
Oh,
is
cool.
on the Eastern Shore, yeah.
So is that how you got to know Dan? Or how'd you get to meet Dan?
We saw him working out at our like local gym, and we kind of reached out to him once we found out like he's a physical therapist, and we saw the stuff that he posts and the content he puts out there, and we were like, wow, we got to chat it up with this guy. So that's really how we met him.
Nice.
He's been such a huge help with helping us get you on the podcast and a lot of other guests. So we're super appreciative.
Nice. Oh yeah, Dan's like a beast. Dan's one of those dudes who like he must have 27 hours in the day. Like he's just doing all the things, man. I respect him a lot. And Dan is a connection that I made through Instagram, through my podcast, through his podcast. I don't even know how we first met, but don't underestimate the power of social media. I got my job literally because of Instagram. That's how I found True Sports. DM'd one of the PTs there and said, you know, or do you know if True Sports is hiring? Sent my resume, but they looked at my Instagram and they saw my podcast and they're like, oh, this girl's fired up. She's about it. She's working out. She's in the gym. She loves athletes. She's a strength coach. Boom, that's it. So like use social media as a portfolio. Like be out there and be passionate because the right person's going to see it. And the person who's sitting on their couch eating a bag of chips, like, oh wow, they're posting like those pull-ups, like that's crazy, like that's so obnoxious. Like, get out of here with that.
That's awesome. We definitely have a very similar mindset as you, and it was great to talk to you and learn all about what you do.
Cool, guys. Yeah, keep in touch. Anytime you guys have questions or want to reach out about anything, I want to send you guys a podcast that I did with the owner of True Sports about new grad life and kind of job searching and stuff. I think you guys might enjoy it. So I'll send that your way.
Sounds good. Please do.
Yeah,
All right. Have a good night, guys.
See you. Thank you.
Thanks for having me.